In El Fasher, North Darfur, a humanitarian disaster of catastrophic proportions is unfolding. The city has become a trap for over 260,000 people, where the very foundations of survival, safety, health, and basic necessities are being systematically destroyed. Imagine a city under siege, where civilians, including children, are killed in escalating, indiscriminate violence. There is no safe place to hide. Access to clean water and food is almost non-existent, fueling widespread hunger and disease. The already fragile health system is collapsing under the weight of sustained attacks and overwhelming needs. And since February, El Fasher has been completely cut off from all humanitarian aid, leaving its people utterly alone. This crisis is horrifically illustrated by the direct and repeated attacks on the city's remaining healthcare infrastructure. In any conflict, hospitals are meant to be sanctuaries, but in El Fasher, they have become targets. The Saudi maternity hospital, the last partially functioning hospital, was attacked 4 times in a single month. One assault killed a nurse and injured 3 other health workers. Just 2 days later, 6 more health workers, doctors, a nurse, a pharmacist, were abducted. In a profoundly shocking event on that same day, over 460 patients and their companions were reportedly killed inside the hospital. Since the conflict began, 46 health workers have been killed. 48 have been injured. The World Health Organization condemns these horrific attacks in the strongest possible terms. This is a grave breach of international humanitarian law. With no safety and no services, a massive exodus has begun. Approximately 28,000 people have recently fled El Fasher, many heading to the town of Tawila. Another 100,000 are expected to follow, compounding a crisis where 575,000 people are already displaced. These are women and children arriving with nothing, traumatized, and in desperate need of shelter, food, water, and care. These overcrowded, unsanitary conditions have created a perfect storm for disease. A deadly cholera outbreak is spreading rapidly. In El Fasher, the case fatality rate is nearly 12%, a staggering figure far above the 1% emergency threshold. This tells us one thing: people are not getting the basic treatment they need to survive. Across Darfur, over 18,000 cases and 662 deaths have been recorded. Compounding this is a severe malnutrition crisis. The blockade has cut off food supplies, weakening immune systems, and making people, especially children, more vulnerable to cholera and other diseases. It's a vicious cycle of hunger fueling sickness and sickness worsening hunger. Despite the extreme danger and lack of access, humanitarian organizations like the World Health Organization are working relentlessly. We are moving 20 metric tons of medicines and emergency kits to Tawila. We are fast-tracking supplies from Chad and coordinating with partners at reception sites to care for the sick and injured. Our trucks are standing by, ready to enter El Fasher with life-saving aid the moment access is granted. But these efforts are not enough. The crisis in El Fasher is a man-made catastrophe. We call for an immediate end to the hostilities. We demand the protection of all civilians and healthcare workers, and we plead for safe, unimpeded humanitarian access to reach all those in need. The world must act now to prevent further loss of life. Thank you for watching. Please share this video to raise awareness and follow our channel for more updates.